Hello and welcome to Marjon Osteopathy Clinic. We're open from 9:30 to 5:30, Monday to Friday. We're offering appointments for anybody between the ages of 4 and when they're great-great-grandparents, so we cover a vast range of ages available for you, and we treat a variety of conditions. We've decided to not charge for any of our osteopathic appointments currently. We figured that this would be really quite useful and might help reduce the burden on the NHS by taking some of the stress away from them from the musculoskeletal complaints or problems that people might have. What would you expect to see when you come to the osteopathy clinic? You'd expect a 3rd or a 4th year master's student to be looking after you, and they are overseen by our fully qualified clinical supervisors. These are osteopaths fully registered and insured with the General Osteopathic Council. When you arrive at Marjon, we'd hope you'd arrive at the sports centre where there is ample free parking for you. The one thing you must remember is to let the reception team know your registration for your car so that they can add you to the system. Once you're at reception, your student will come down and get you and they'll walk you through to the clinic. All the students will be wearing full PPE, which means a visor, a face mask, gloves and an apron. They will all change their clothes when they come in into their clinic attire and then change before they leave. The university have also invested in something called quick rooms, which are these lovely little rooms that we put up which give us much more space and are much easier to clean down. This with our enhanced cleaning and antiviral fogging which goes on during campus can make sure that we are giving everything, taking as many precautions as we can and making sure everything is working as it should be. Your initial consultation will last about an hour and a half, so about 90 minutes, okay, which is the amount of time you get for free parking outside, so that works very nicely. And what will happen in this 90 minutes is you'll have a case history taken. So your case history will be all about the pain, the presenting problems, everything that's going on with you at the moment. So it might be all the way through to your diet, exercise routine, all of those things, your lifestyle. The student will also ask you questions about any systemic issues, so systemic health, if there have been any problems with your heart or anything like that. This is really valuable information for us because we need to be able to make a clear and clean diagnosis of what's going on in order to make a good management plan. Once the student's got all the information that they feel is necessary, they'll leave you in the consultation room and they'll pop outside to go and have a chat to the clinic supervisor. Together, they'll review the information and come up with a list of differential diagnoses. So this is basically a couple of the things that it could be, and the student will then look at how they will test and work out what is going to go on. So when they've had this conversation, the student will come back in, we'll ask you to undress to whatever is appropriate. So currently at the moment, if it's a knee, it may just be roll your shorts up so that we can have a look at the knee. Okay, if it's your lower back, then we may need to take a top off, but we do ask all patients to bring in a pair of shorts and a t-shirt that they can move around easily for their comfort and for their modesty. Once they've done this, what we would do is the student will be going through some examinations. So this may be sort of active movements, bending forwards, bending backwards, straightening the leg, bending the leg, and also orthopedic testing, so specific testing for certain conditions. Depending on what's going on, they may do a full neurological screen or they may do some systemic screening. That will depend on what your condition is. Once the student is happy that they've completed all the testing they need, they'll pop out again and go and have a chat to the tutor. This is when they'll form a clinical diagnosis or a working diagnosis, which they will come back in, discuss with you, discuss the treatment and the management plan of that, and then once you're happy with that, start to treat and advise and hopefully make you feel a lot better in the shortest possible time available. Thank you for watching this video. I hope it's been informative for you. Don't forget you can book via the link and we look forward to seeing you and helping you soon.